All right, we're live now. Hi, everyone. Good evening. We're going to take a
Hi.
few seconds to let all of you jump into this live, and for those that are already in, please let us know in the comment box if you can see us and hear us, and tell us where you're watching from. I'm also going to take a minute to quickly share this across our multiple groups so that everyone can tune in quickly. Hi, Rohan. Okay, I see a couple of comments. Hi, Rajiv ji. Hi, Preeti. Preeti is from Chandigarh. Great, good to have you. All right, I can see people coming in. Hi, Akshara. We missed you today and yesterday. All right, so as our friends keep pouring in, I think we'll slowly begin, and I'm very very excited today to introduce all of you to Dr. Sona. Um, so this is going to be a really amazing, interesting workshop, and Dr. Sona has kindly agreed to, spare an hour from her Sunday evening with us. So thank you so much, Doc, for doing this. And I'm quickly going to, tell you who Dr. Sona is and what she does. And so Dr. Sona is, an endocrinologist, and she's trained in internal medicine. Please correct me if I'm wrong, Doc. And she's been practicing, for the past 15 years in India, and she's really, really passionate about emotional well-being, as well as metabolic diseases, and the whole interplay between mental health and physical health. And I'm actually really inspired uh, by all her tweets and the amazing content that she puts out. And that's how sort of we're here this evening. So Doc, over to you, and tell us a little bit about yourself. And it's wonderful to have you here.
Thanks, Nupur, for the opportunity. I'm an endocrinologist primarily. I kind of grew up in Calcutta and Delhi, and then did my med school from Trivandrum, and then moved to the US, did my medicine residency, my endocrinology fellowship from Joslin at Maryland, and then moved back to Delhi. So I was at Delhi for about 10 years. I was heading the endocrinology department at Batra Hospital. Then moved. My parents are here in Kochi, so I moved about 5 years ago to Kochi. So I've been here for the last 5 years, and my journey through, primarily as an endocrinologist, but stumbling into this space of, say, emotional well-being and metabolic health sort of happened as I started realizing that there were so many patients who came to me with concerns that might be their hormones, or that they're not feeling well. And the complaints sort of seem to have patterns, but the lab reports never really matched up. And then I started trying to dissect the histories to kind of get a better sense as to why are things not adding up. And that's when I stumbled into the realm of emotions, and I sort of call myself an emotion scientist, and starting to understand myself as a process, because I realized I'm a deep feeler and as an empath. So I try to sort of correlate what I am feeling with what my patients are feeling, and sort of use my own learnings, hack my own brain, and sort of try and be able to give solutions that would work for my patients, help them see what's going on really under the surface, what they had probably never connected the dots to. And my struggle was having very little time with the patient, so to be able to be more effective in getting a history faster, getting a connect faster, so that But then what I've realized is that the patterns are always there, and it's like once I've seen many, it's sort of easier to get to that story faster. And when the patient says, how did you ever do that, how did you pull all that out of me, how did you just know everything that's going on in my life, I've said I've seen so many that it's now sort of starting to become not rocket science anymore.
Yeah, yeah. I'm sure there's like a really sort of a pattern, right? I mean, things are for the patient. We might think that this is something really unique to us, but it's really
Yes,
actually happening with millions of other people.
absolutely.
Uh, so I'm going to jump straight in, to the questions, and I can see a bunch of people. Suresh, hi. Snehal, hi. How are you? Please share your questions and comments for Dr. Sona in the comment box. So I'm starting off. So, Doctor, how closely are metabolic health and mental well-being, linked from a physiological perspective? I know you touched upon it a little bit now, but there's something you want to add.
Yeah. See, the more we have started to understand sort of the mind body connection, so to say, mind body gut endocrine connection. So, what happens is we have, for simplistic purposes, we have, a rational brain, which we call the prefrontal cortex, and we have a limbic brain, which is the amygdala, hippocampus. So the rational brain always appeals to logic, but the limbic brain is an emotional brain. That's where memories are stored, emotional memories especially are stored. And very often when we've had histories of past trauma, emotional pain, things like that, so those tend to end up hijacking our limbic brain, so then we can't think so rationally. And in the moment when people feel hijacked, they actually start, what they usually complain about is like a tight feeling in their chest, which we medically call a globus sensation, a pressure in their chest, feeling like they cannot breathe. They feel like they might pass out. They feel, nausea. They feel like their stomach's not feeling too good. They feel like creepy crawly feelings all over their body. So, like, these are the vague symptoms, and they end up wondering whether to see the cardiologist, whether to see the gastroenterologist. And by the time patients see me, they've had so many investigations. And when I start talking to them, you realize what is happening is this is starting a cascade of hormones that start from the hypothalamo pituitary axis. Your stress hormones, your adrenals pump out adrenaline. So all these things are sort of surging through your system. And these are all anti insulin hormones because they jack up your need for insulin. And in somebody who has diabetes or no diabetes, whatever said and done, we are creating a situation where people are starting to become hyperinsulinic. And not just insulin, the other things which are inflammatory cytokines, which cause inflammation. Especially what's concerning is endothelial inflammation, which we today think is probably, the starting point of atherosclerosis. And that is why we are starting to understand, all this is sort of far more interrelated than we'd like. And you could say we are talking a lot about mental health, we're talking about a lot about our feelings, emotions today than we ever did in the past. And that was partly because nobody was ever taught how to express themselves or ever talk about their feelings. You have, what we see in the movies or what we hear in books and stuff, but normal you and me, we didn't know how to talk about, we didn't have that emotional vocabulary to sort of express what we are feeling, express our needs. And we are taught from a very young age, and a lot of this is culture, especially in India. And you're taught to suppress. Both men and women are taught to suppress and repress their emotional sides. And that leads that silent conflict because you don't speak up either to your parent, either to your spouse, either to your higher authority. All that festers in our body in terms of, we are sort of fighting the silent battle, causes an anxiety episodes, prevents us from switching off when we are trying to sleep, in affecting the quality of our sleep, Many people wake up feeling exhausted, tired, unable to, feel like lead. They don't feel like going to work the next day. And they think, and what's happening? And you'll see that there's sometimes they're not actually touching sweets, or they're probably trying to do a lot of things that are right in terms of health wise. They're exercising, they're doing a bunch of things. But a lot of these things show up in the sugars.
Correct. I think what you just said, resonates with me so much. The point about, like, suppressing or repressing your own self as a cultural thing, or maybe sometimes you think that, okay, I am a strong, silent person. I know that's something I struggled with. And I know that our friends in the audience are probably also nodding their heads. So feel free, guys, to share in the comments what your thoughts are, because it's one thing to get diabetes, but it's a whole different thing to deal with, acceptance and management and lots of other things. Hi, Raki. So Rajiv ji says emotions affect your blood sugars and vice versa, and how
Absolutely.
should we cope with it? And that's really, what we're going to have Dr. Sona sort of explain to us in detail over the next hour. Snehal says this is such an important topic, and Akshara says I often find my sugars rising in a stressful meeting. Absolutely right. Jumping on to the
And
next, sorry, yeah.
you go ahead. What were you saying? Yeah, go ahead.
I was going to head to the next question, but if there's something you want to
No,
say.
I'll just share a small story of one of my patients who actually got me thinking about emotions in the first place and this correlation with sugars. So there was this gentleman. He was this was back 10, 15 years ago, and he was a Jat gentleman working at one of the Hero Honda factories, and he would come very often with very high sugars, 300s, 400s. He was a type 2 diabetes, but like a burnt out insulin requiring diabetic. And he would come in, you're saying my sugars are haywire, doctor sahab, admit kar do. And
Oh,
yahan pe reh ke, my sugars will be okay. And I would say, what is the point? What is the point of admitting you for sugar control? Because the minute you go back, you're going to go and do the same thing. So that was a younger me, not knowing, the correlation to this extent. And so after several of these admissions, we kind of bonded. And there was a time when so he was on basal bolus, and his sugars were very controlled, and his bedtime sugar was 150. And the next day morning, I got a call from the nurse saying that his fasting sugar was 550. And I'm like, and I went on rounds. I was almost ready to scold him, and I was like, you've done something wrong. आपने जरूर रात को मिठाई खाई होगी. And then he's like, no doc, मैंने कुछ नहीं किया. घर से 2 बजे 3 बजे घर से फोन आया था, and मैं एकदम परेशान हो गया. And
oh,
I was like, how can this be so much of a pareshani? Then he told me his story, and then he told me that he has a son and a daughter, and he's no more. He passed away 4 5 years ago, but his daughter was a chartered accountant, and in the Jat community, typically girls are not that well educated, and she wanted to get married to a very well qualified guy too. So he was like, "मैं कहाँ से ढूंढ के लाऊं? मैं थक गया हूँ, and my everybody is after my life." And then he had a son who was did his engineering, and then he couldn't find a job, and one day he just ran away from home. The police called him saying that he was in some station somewhere, completely unaware of where he was, and that was a night that his sugars had hit a 500. And then I realized then I started talking about this to my endocrine colleagues. And my another friend, she mentioned that she had been doing continuous glucose sensor monitorings. And she noticed that there was this patient who's every Tuesday and Friday at like a certain time, of the week, at a certain time the sugars always went up. And she was like, kya Marjan? Then she started asking what happened. It's like koi rone wala serial hai, and the moment she sees that, her sugars go up.
oh my
So
God.
thing that once we start, see, we never had continuous glucose monitoring till so recently. And now that we start seeing patterns, because all we had was a sugar check, and all that told us was, and we didn't know what changed? What was the trajectory? Now when we start, I tell people, not just food diaries, but if you have a stressful event, also note that down, because
Correct.
that would give us insight into what is going on in the body. And so that is sort of where, this whole journey, then that's when the story. But I realized taking a deep personal history was
Yeah.
very key in terms of
Yeah.
finding out.
Yeah, absolutely. I didn't know whether to laugh or to, like feel, sort of empathy, or probably a mix of both. When you describe the TV serial that happens on Tuesdays and Fridays. I'm going to quickly scan through the comments here. Suresh says emotions do play a part. I agree. And Snehal says, I agree with what Dr. Sona said. It took me years to accept type 1 diabetes, and this internal conflict seeped into other aspects of my life. Yes, absolutely. Harneet says, so true. Preeti says, I can relate to the stress that damages. So I think everyone's on the same page here. And a quick reminder, I see more people joining in. So welcome once again to everyone. We're talking today about metabolic health and mental well-being with Dr. Sona, who's an endocrinologist and takes a very keen interest in mental well-being as well as metabolic diseases and the whole sort of play between mind and body. And we're having a really interesting chat. So join in, tell us where you're watching from, tell us if you have any, ask us if you have any questions. And I'm going to head to the next question now. So doctor, what's the impact of chronic stress on metabolism, especially for people who have, like, type 1 or type 2 or any other type of diabetes?
Some of which we just talked about. I think the problem is when we are chronically stressed, we are in a state of chronic inflammation inside the body, and this is not just hanky panky kind of chronic inflammation out there. We actually are starting to see inflammatory markers. We don't usually typically measure, but in research settings, we have been measuring inflammatory cytokines, and we see that goes up. Our cortisol levels are, like we talked about, the adrenaline levels, all these kind of go up. And that chronic inflammation has a lot of physical manifestations. And in terms of a lot of times, what I believe, things like what is called fibromyalgia. Okay, now this is a term, like a random term for us doctors telling people we don't know what's going on. And that which I've started to understand when I take a history is that lot of that is chronic stress, where imagine you are in a fight. Okay, all the time you're in a fight flight mode. Your body is constantly, every muscle in your body is tensed up. Now imagine that happening only for an exam or some random episode. But imagine being that way every single day, day in and day out. Now for a type 1 diabetic, there are more layers of problems, because especially in the early years, for one, till you accept what's going on, there is so much of having to even accept that you have type 1 diabetes, and this is how it's going to be for life. And coming to deal with it, communicating about that to people. I was just telling you a little while earlier, Nupur, about the young kid, the girl that I had seen a few days ago, who had come with severe ketoacidosis and who had not shared with any of her friends that she had type 1. She's been a type 1 for about 6 years now. And none of her teachers knew she was going to the bathroom and taking her insulins. And I said, Beta, you probably are not taking your insulin, right? She said, no, doc, I'm not. And you're not checking either, right? No, I'm not checking. She has a working mother. I don't blame anybody, but it's so much of all this pressure of the sugar going down, sugar going up. Even though you might not be checking, now these sugars have an impact on how you're feeling also, right? If somebody is going down, the kid is in class, they can't focus, and everybody is like, oh, you are being lazy, you're not paying attention. And this particular kid, because she didn't even know that her sugars were 500 for so long, her mother would, she's coming back from work, she's exhausted, you must have, why are you not studying, why are you always tired, why are you making this up? So there is so much of added trauma from the people who you want empathy from the people you want to love you and say, I understand this is hard. And sometimes that's exactly what you want to hear, and that's not what you hear from anybody. And
Correct.
internalizing all that, keeping that all inside, not having a support group who you can say something and you say, you know what, I just feel just the same. And just that just relaxes people. People are honest with each other. And the funny thing is, when you can be honest to another person, this tiredness, this fatigue, this stress, you just ease up.
Yeah, yeah, that's so true. That just takes me back to last evening. We had a little sort of a chai coffee catch up in here in Pune, and we do it across several cities. So this morning it happened in Delhi, and last evening in Mumbai and other places as well. And people just meeting and talking to each other, and like you said, just being honest, saying it as it is. That, hey, listen, I've gone through the same thing, and it's not a bed of roses, and there's no pretense here. This is how it is. It's not easy. I think just being able to sort of say that also really makes people feel relaxed, and it's actually, I feel like it's both ways. It's not just the receiver of the information, but also the person that says it. Yeah, even the giver. So, Doc, there's a question from Radhika. So, Radhika has type 1 diabetes, and she's also an educator, and she's doing lots of cool stuff. Her question is, hello, doctor, how should we take care of our mental health from the perspective of, having diabetes and or a metabolic disorder?
See, I think when I talk to my patients, I think the few insights I have gained in terms of I think what we can do to kind of take better care of our mental health. I think couple of things which come to me straight off the bat is, we need to teach people, everybody, not just diabetic, not diabetes. People need to learn the art of saying no
Yeah,
and not taking on more than they can bite. That's one
correct.
thing. The second thing is, we are taught to please people, and that is another big struggle. So because of which you internalize a lot of things which you want to say, which you're not able to express. There is this silent conflict that's going on in the mind, and that is something. So now the question is, if we can talk about, we know that if our mental health is not okay, our metabolism over time will not be okay, our sugars will not be okay. And we need to come back and think about, what can I do? What can I change in my life? For many, it is to let go of perfectionism, to say it's okay, this is okay. There are things which are important, there are things which are not so important. Sort of recategorize, take a few things off your plate. Again, comes back to the skill of saying no. Third, learning to have uncomfortable conversations,
Yeah.
saying that's what you did to me hurt me. I do not want to be treated like that. So a lot of these common themes run across every patient,
Yes, absolutely.
and
And
that asking needs to happen.
yeah. Yeah. And I'm, reminding myself what you just said, and I'm going to try and remember it even after this workshop. Of course, saying no, trying not to chase perfection. This really sounds like you're talking to me. And I know a lot of my friends, feel the same way. Salim has a question, and he says, is it a practical idea to have a moderate metabolism and not fast, not slow? And if yes, how do you reset it? And are there any practical tips to building emotional resilience?
See, Salim, I think, see, the thing is, metabolism is not something like, say, a thyroid hormone blood test where, I add a little this and I subtract a little this and we can sort of get our metabolism where we want it. It doesn't work that way. Some of it, in terms of what we typically think about being fast and slow, is really our metabolic rates. Some of it is genetic, and some of it by sort of striving to get to where we need to be in terms of, say, our optimal weights, or at least I would say it's a journey. It's a journey. It's not a goal. It's not a target. Okay. And I think very important to understand that we have now moved away from thinking about overweight, underweight. It's about a personal fat threshold. I could look lean, but my body inside may not be lean. And I need to understand where I stand in terms of that. My metabolic health, which might go by my lipid markers, my liver function tests, my if not for a type 1 or a type 2 diabetic, we probably may not be worthwhile checking an insulin level to see hyperinsulinemia. But those are all, even say somebody if somebody is a woman, I mean, irregular cycles could just be a hallmark of metabolic dysfunction. So if we work on sort of streamlining our, forget about the type 1, type 2 diabetes part, if we start channeling into what can I do in terms of physical activity, which would improve our markers, our metabolic markers, our diet, so that we're not on a roller coaster, and we can sort of smoothen out the glucose variability, as well as our hunger, as well as our weight. So if we can do that in terms of, these are the things which are in our control. And the other parts are what you talk about, the building the emotional resilience. I think it's like any skill. If you want to learn how to play cricket, how would you learn? You will have to start facing a few balls. Maybe first few times you might not be able to even hit the ball, but over time you start getting better. Then you start learning to deflect maybe earlier, then later over time chakke chokke, you will. So it's something you will have to maybe start testing in a safe space, maybe with friends, maybe in your smaller circles. And as you grow in emotional resilience, you will start noticing the benefits in your numbers. Okay. And I always talk about personal development. I emphasize a lot of on personal development, because when you develop as a person, when you're able to manage yourself and grow yourself as a person, you become better at your professional relationships, you become better at your personal relationships. And if you can be better at both these relationships, your conflicts go down. And when your conflicts go down, your emotional health and your mental health and your metabolic health will all go much better.
Yes. I think this is one of those rare workshops where I feel like, the speaker as well as the sort of commentary that's going on in the comment section is so beautifully aligned, and I see what you speak is really, the personal experiences that people are sharing. And I want to read out Snehal's, and she says that saying no and setting boundaries has helped me, and it's not been easy, and people were not happy, but it saved me from disappointment and frustration. And
I
Salim
agree
says,
with Snehal. I agree with Snehal. To add to what Snehal just pointed out, see, as a doctor, okay, doctor practicing in India, okay, it's very difficult, to be honest. And when, see, in the US, where I trained, there is a system that exists. If a patient needs, there is an emergency, they go to the ER. If the patient needs to be in touch with their doctor, they have an answering service. Somebody will take their messages, and it'll be passed on to the doctor. So there is a system that exists, but in India there is no system. So I used to hand out my numbers to everybody, and my phone would be ringing off the hook, and I wouldn't be able to even focus on having one single conversation. So when I moved from Delhi to, and the only people I now give my phone numbers are only to my type 1 diabetic kids' mothers, because I know it's sometimes just for them to feel that they have somebody to reach out to. Maybe it's like some silly question which doesn't need to be a formal consult, and I know it'll get better. It's like teaching somebody to cycle. Over time they'll learn cycling and they won't need you. And the best part of a support group is then the group takes care of each other. So that's the beauty of it. So
yes, absolutely. Uh, Akshara has two questions, and she says that does high glucose variability affect long-term metabolic health, and how what markers should we consider, for uh, to have good health long term?
See, when we talk about glucose variability, see, in the past, so when I was in med school, all we had was urine blood sugars. Okay,
Yeah.
so as a house surgeon, I would run to the lab and run our patients' ketones. We would do ketone tests. Times have changed. We evolved to the times when we had a glucometer test. Once we started, but then most people in the past would just check their fasting sugar, and many people have this misunderstanding that fasting ठीक है तो सब कुछ ठीक है.
Mm.
Fasting 100 hai, doc. So then why check the PP? But I tell them your fasting could be 100, your PP could be 300, or it could be 140. So then came the HbA1c, which was one more data point. So when we started seeing the HbA1c, we would be like, okay, HbA1c is 10, your fasting is 100, zarur kuch gadbad chal raha hai. And we know that there is glycemic variability happening. Now, which the HbA1c doesn't tell you is what if a patient has an HbA1c of say 7.5. Okay, now they're doing 60s, 40s, and 200, 240s. The HbA1c will still look 7.6, but that is detrimental to your health. That kind of glycemic variability is what causes damage to the autonomic nervous system, your peripheral nervous system, is probably still causing that high sugars to cause glycation end products that damage the kidneys, the eyes, and over time, even the cardiovascular health. And that is what shows up as coronary calcification when we do CT, coronary CTs.
Yes. Just a reminder to our friends watching that this session is being recorded and it'll be up on our Facebook page where you're viewing it now. It'll also be on YouTube. I know for one, I'm going to go back to the session and catch up on certain points, because while I'm chatting now with Dr. Sona, I'm in a different mindset. But I know I'm making mental notes of what I want to go back and watch, and I'm sure you guys want to watch it again as well, or share it with someone who isn't able to join right now. So please do that. And of course, every Sunday we meet 5 p.m. and we do these workshops that all of you here, a lot of you have hosted workshops in the past. So yeah, so sorry for that little digression, but I'm now actually jumping into a question that I've been waiting to ask Dr. Sona from the start. And I have a picture of you in my mind. Of course, this is the first time we are meeting, but I already sort of I know, I mean, I had a sort of this thing about how what you're going to be like. And I'm very, very excited to be asking you this. So and I think a lot of the friends here in the comments will understand why. So I keep talking about low carb a lot. I really enjoy it. It's amazing. And now I want to ask Dr. Sona. So how does diet really influence our not just physical but also mental health? And as an endocrinologist, you advocate for low carb, and as a patient and as a end sort of user of the whole system, me and a lot of others on our in our community also do low carb. And how does that help? People have some reservations, and
Yeah.
so
Mhm.
what's your
No,
take?
I think in the doctor community, I'll tell you, low carb has a very bad rap, because partly because many doctors, when they hear low carb, their mind goes to keto.
Yeah.
And when you are, and the problem is how keto initially happened, how the initial studies happened, how the data points are looked at. I think our understanding about the human body is only still evolving. In the past, we are always looking at sort of associations, and correlations. We are not really sure whether we are catching the right things. For example, I'll give you an example. So in there was recently a big study out of Kerala. Okay, and what was found was in terms of metabolic health, and the people who had a lot of fruits and snacks, they tend to have a lot of metabolic health. And what was found was those who had high meat and rice. They also had poor metabolic health. Now, the thing is, if we start teasing out, now typically people, when they have high meat, they also have high rice. Probably the rice is or much higher than the meat. And we are blaming the meat for what the rice did, probably. So I think, and this is how I enter a conversation with all my type 1, type 2, metabolic health, PCOD, everybody. I say if our fundamental problem for so many metabolic dysfunctions we see today is a state of hyperinsulinemia. There is a lot of the question about chicken or egg kind of situation. We have fats, we have proteins, we have carbs, our main macros. Now, if we look at fats, the amount of insulin requirement is very low. For proteins, little more, but much lesser. Amount for carbs, carbs are going to be converted to sugar. Now, the more complex your carb is, the slower will be the conversion to sugar and maybe more delayed and maybe to a lesser extent, but the actual sugars obviously are going to be through the roof. And the kind of, even fruits are going to be eventually converted to sugar. I mean, fructose, but fructose to the liver is sort of similar as in terms of alcohol, to be putting it that way. Now, when we combine all this, and our goal from a metabolic health standpoint is to be able to lower our levels of circulating insulin, so which is very easy for a type 1 to see, because you're actually seeing how many units you're using in a day, which is not obvious for a type 2, especially who are on drugs or who are on lifestyle changes, because they're not able to see the change in numbers. So if you are a type 1 and say maybe you were metabolically unwell at some point, and how your lifestyle was, you were needing 50, 60, 80 units of insulin, and now you're able to bring that down to say 14, 15 units of insulin, you've already seen what was invisible in a very visible way. This is very hard for a type 2. Now, that is exactly what that below part of the iceberg, which many don't understand. So, when we cut down on the carbs, we are automatically lowering the insulin part. The second part of this low carb thing is what we have to put in perspective is, when we say low carb, we are asking people to up their protein, natural protein in their diet. And when you actually add more natural protein in your diet, now the 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 the, the animal sources of protein are little better quality protein, because they actually cause more satiety. That is really the main advantage. The problem with the vegetarian sources of protein is they are all coming with the carbs. So it's almost like a 4:1 ratio of carbs to protein. So because of which, it's not that that's undoable, but that's the thing to keep at the back of your mind. So when you have more protein, you're already much less hungry. When you're much less hungry, you're able to predict your sugars also much better. You're going to do less of the roller coaster with your sugars, and that in turn makes your mental health also better. Because I'll give you an example. Type 2 diabetic, one of my friend's husband, and he was on a medication that would cause him hypoglycemia. He was on a glimepiride, and every day by 11:30, 12, he's in a meeting, he knows he's going to go low, and his temper starts rising, because partly it's anxiety, partly it is that feeling of discomfort, feeling, starting to feel upset and irritable and all that. And I changed him to a medication which does not cause him hypoglycemia, and I told him, just be okay, you can eat less, you'll be fine. And he's like, Sona, I'm actually feeling so relaxed, because I know that, by 2, 3, even if I am stuck in a meeting, I'm not going to go hypoglycemic. And just very recently, his wife and his mother-in-law told me, Sona, I don't know what you did to him. He's so much calmer. He's not angry as much as he was before. So I think the ramifications of all these things, we don't, as doctors, we do not understand. We only see numbers. We don't see the patient, their environment, what's happening behind the scenes in their family, how these things are actually influencing their lives. And that is why I've started to feel the carb. So again, the other part is insulin doses. So say you have 5 chapatis, and 5 chapatis need 30 units of insulin. 30 units is going to cost you 30. So when people talk to me about cost, I tell them, we can cut down on the carbs, and your insulin levels are automatically going to come down. Your cost of insulin is also going to come down. Your cost of medications will come down.
Yeah, yeah. Love it. I also see Yoland has joined us. Yoland, if I may share your story very briefly with Dr. Sona. Yoland got diagnosed at the age of 65 and now is, I think, 76, and with type 1 diabetes. And that was really, initially, a couple of years ago, we knew of literally no people that were being diagnosed with type 1 at that age, and now we see a lot more people, but
Yes.
and I know Yolande does low carb as well, and she's tuning in and saying it's a very interesting discussion. So, and if I may also quickly share my experience, it's been incredible with low carb and all of the things that Dr. Sona mentioned. One, that sort of the anxiety of, I mean, I'm sitting here and chatting with doctor. I'm sitting here with my glucose, and I'm just sitting with it because it's protocol. I mean, I must have glucose with me at all times, but I don't have that burden mentally that I'm stressed that I'm going to go hypo in the middle of a workshop, or I'm going to go hyper and all of that mess, because small, less carbohydrates, less insulin, and less sort of variability, which leads to less hypo and less hyper. So my mind is at peace, and I've also felt a huge amount of mental clarity, which back in the day I didn't know that I lacked it. But when I started doing low carb and I realized, that there is a different, I'm on a different side now. I feel like my brain actually works. This might sound a little funny, but I actually feel that sort of brain fog, or what you call it, has lifted. Also, I lost a bit of extra weight, and I'd been running for years. I mean, I did it because I enjoyed it, not for any specific reason. But I think I always had that little bit of extra weight going on, and I thought, okay, cool. I mean, it doesn't matter to me, but it does matter when when you drop a couple of extra kilos. You feel fitter, you feel healthier. I mean, what's not to like? It's incredible. And for the people that say that it's not sustainable or it's not affordable, well, we all know how much an egg costs, right? Like 6-7 rupees. That's roughly how much. It's probably the cheapest and best source of protein.
Absolutely.
So totally doable. And I hope that doctors validation also adds to the concerns that some of you may have about whether low
I
carb
think
is
it's changing, Nupur. I think gradually, I think I can start seeing. So I've been talking a lot about low carb and diet and stuff to my colleagues in the hospital. And I talk to my nutritionists. I tell them, you need to keep up to date in terms of what's going on. We have to experiment, look, see what number. So every time I'm learning from my patients. When I tell I'm learning from myself. Whatever I tell my patients, I do on myself first, and I have to sort of satisfy myself first before I can pitch that to anybody.
yeah,
So that's how I work, at least. And so anything I do, I have to see, is it doable for me? So when nutritionists tell people, have 6 meals a day, बीच में सलाद काट के खाओ, बीच में एक फ्रूट खाओ, बीच में ये खाओ, मतलब कौन ऐसे खा सकता है? I mean, who has the time? I mean, we are all working people, we have I mean, if somebody says you can have 2 meals and you'll be great, then I think more people will be absolutely fine with that. And if you could act, so when I tell people, the whole point, say if you're a type 1 to be on a basal bolus regimen, is that you have the convenience to eat when you want, number one. Number two, you do not necessarily have to keep snacking. The snacking concept came at a time when we had older insulins like NPH, and that was causing, pre-meal hypoglycemia, mid-meal, 2 baje raat ko hypo. So a lot of this snacking, whole how the diet has been structured, came about the old insulins. But our diet logic still continues even with the newer insulin. And now we are dealing with a completely different problem. If you look at the US, all type 1s are dealing with a severe obesity epidemic. And the whole mental picture of a skeletal type 1 diabetes doesn't happen anymore. Back in Delhi, all my type 1s were getting to the verge of being obese because they know "Acha, jo marji khao, dose laga lo," and a lot of the kids are really smart. They know how much they've, that is something they're super motivated to do कि cake पे कितना लेना है, french fries पे कितना लेना है, and they have that math so good in their heads. But people didn't really think that type 1s also had to deal with metabolic dysfunction. We
Yeah.
only thought about microvascular disease. Now we are starting to understand that macrovascular disease and metabolic dysfunction also will exist, because what we are effectively doing is converting a type 1 now to a type 2 diabetes.
Yeah, yeah. Correct. Absolutely. I mean, we talk about double diabetes, and that's literally, we see it in amongst all of us. A lot of us, are putting on extra weight, and while on the one hand, body positivity and being comfortable in your skin is important, it's also important to remember that this is a choice. You have a choice and a chance to fix yourself. And I'm quickly reading out the comments. Rita says, type 1 diabetic for 44 years. This session is answering so many of my questions. Thanks, doc. Preeti says, sorry to say that doctors usually don't give that much time to explain so deeply to their patients. And I'm so thankful to Doc Sona for discussing so deeply. Thank you so much. We have
I just
another
want to
fan.
make a point, Nupur. See, I have, as a doctor, having trained in India, having trained in the US, when I came back to Delhi, there was a lot of inner conflict for me
Yeah,
because I wanted to practice medicine a certain way. And
yeah,
the whole system in India doesn't let you practice. India is a volume based practice. And, speaking from the other side, the doctor side of things,
yeah,
you are only, if I talk to my management and say, if I have to give say 15 minutes to a patient, then how many patients can I possibly see in a day? And if you're going to be seeing 100 patients, then what kind of quality of care can you give to anybody? And
correct.
the problem when it comes to type 1, you, as a type 1, you have a diabetes educator, you have a dietitian, you have a doctor, and sometimes all of them don't speak the same language, and
Yeah,
that is extremely confusing to a patient because, and doctors in India typically don't entertain any struggles that the patient has, because it's really comes back to time.
correct.
Nobody is in the position to listen, and that is a real big problem of healthcare in India. And I don't know what's the solution. I can only decide that I will practice medicine a certain way, and for that I have had to fight a lot to say, this is where I draw the line, and I have to be only able to practice for so much. There is only so many I can see, because I have a home to run, I have a home to come back to, I have kids to take care of, I have my own mental health to take care of. So
Very
if
true.
I am going to not learn to say no and prioritize, then the quality that I can give to my patients is also going to suffer. But I mean, it's all circuitous.
And what you said, a few minutes ago about not telling somebody to do something without trying it yourself. I think not a lot of people walk the talk, but I know that you sort of follow this way of eating yourself, and of course you share the benefits for patients as well. Quickly scanning through, Junaid is tuning in from Pakistan, and he says, "Well explained, doctor." Um, and I think what he's trying to say is basically that इतना information नहीं मिलता है जितना अभी मिल रहा है आज. Also, Deepa says, I got a new picture today. My endo never gave me this aspect, and they've just been bothered with the HbA1c and the insulin, and this sort of depth that's coming in today. And Deepa, I think I missed your previous comment earlier. You said, Deepa says that when she lost her father, her medical reports were normal, but some markers, that whole flight and fight situation that you mentioned, doctor, and she's been diagnosed with type 1 1.5 years ago, so that was a stressful time for her as well. Suresh says, good thinking, doctor. And there's also a question by Akshara, and she says, as a type 1, if I am pre bolusing, if I am not causing a rise, and if I'm maintaining a steady graph, what's the issue? I think, Akshara, you mean what's the issue if you don't do low carb? Is that like, is that sort of what you're asking? Or, um,
See, I think Akshay, if that is what you're asking, see, as long as you are doing a great job carb counting and sort of, you're matching your insulin to carb ratio, and you're able to maintain smooth sugars. I think that's great. So you will deal with two main issues that we are talking about, say type 1, any diabetic, type 2, type 1, anyone, which is glucose variability, and and keeping your HbA1c under control. This will definitely help you prevent microvascular disease, which is your retinopathy, your nephropathy, to some degree your neuropathy. I say some degree because we are starting to understand that neuropathy may not just be a microvascular complication. It may have a lot more to do with insulin resistance and sort of the metabolic syndrome part of it. And what happens in many type 2 diabetes patients, or even obese patients, is that when they start having neuropathy even before the diabetes kicks in. And even when you control the sugars, the neuropathy doesn't always rebate. And studies have shown that when you actually do bariatric surgery, the neuropathy goes down by a much drastic change. So it's not just about the sugars when it comes to that. So HbA1c, glucose variability helps with the microvascular part. But now, at the end of the day, what are we all worried about? Now we have better insulins, we have continuous glucose monitors, we have insulin pumps, we have all gizmos. Say you have a closed loop pancreas tomorrow, okay, which is cheaply priced and everybody can afford it. So where does that leave you? You're just going to become everybody else. And everybody else is now dealing with metabolic disaster. And that everybody else, the metabolic disaster, is manifesting as coronary disease, because that's the ultimate thing that's going to get us.
Yeah.
Today morning, I was called in to see a young kid. She was admitted for something. I forgot to see her yesterday, so I went in to see her today. She's 9 years old. She's about 135 centimeters, about 58 kgs. She has mom and dad, both severely obese, and they were like, it's okay, she's a kid, she's always been obese, or वैसे भी इसी उम्र में तो खा सकते हैं, when you grow up, who कौन खा सकता है. So there is this concept in Indian families that when you are a kid you can do anything and get away with it. I think that's so wrong, because now what is happening with all this baseless logic is, what used to happen when people were 60 and 70 is already happening in 30s and 40s, and now we will in another 10 years see that in 15 and 20 years. I
Yeah.
see 12-year-olds with fatty liver. The US right now, the way it stands, almost 60 to 70% of kids at the age of 5 have fatty liver. And that is just showing a start of metabolic dysfunction. Even before people develop a paunch, their liver is already stocking up with fat. And to some degree, the pancreas also starts getting infiltrated with fat. That also reduces the pancreatic insulin secretion.
Right.
So either way, whether you're type 1, whether you're type 2, the metabolism part, getting towards your personal fat goal part, doing, the exercise that you can do and sustain. See, everything comes ultimately back to sustainability.
Yeah.
Because if you are not able to do something consistently, even if you can, at least, even if you fall off, just keep getting back. Don't beat yourself up. Be compassionate with yourself. This is something I always tell people, because including myself, I mean, it's not just what I tell people, because there are times that I'm struggling with a lot of things and I have to tell, it's okay, tomorrow is a new day, I start again, and I'll try to be better today. So but over time, when I look back 5 years ago and how I am today, I think I've come a long way. And when
Yeah.
I tell parents that they have to role model, it's like, nahi, ab hum to bade ho gaye. And this particular 9-year-old kid, her father last year had an MI,
Oh.
and he was a bodybuilder and all that. So they were thinking that this is not going to happen to them. So if we don't model as parents, now many people, they may not do anything for themselves, but when they become parents, they will do that for their children. And
Yeah.
that is a purpose, that is a motivation. We all need some kind of motivation to kick us into action. And sometimes we don't do things for ourselves, but we do things for the people we love and care.
Correct. That's really true, and you know what you said about the MI actually, reminded me of so a friend of ours, a type one friend. I think type one over 20 years. And if you look at them, they look really quite fit and absolutely fine. But they had an angioplasty a couple of weeks ago. So I think these are things to consider. And when you've had a condition for a couple of decades, you really want to eliminate the variability and the chances of something going wrong. So Yolan says that weight is my big problem. Akshara says, sorry, I'm not very pro low carb, and that's absolutely all right.
That's
It's
okay. That's
yeah,
absolutely okay. Yeah.
yeah. I mean,
No,
yeah,
Akshara, there is, I don't think there is, this is, see, again, I don't, I'm not a very big believer of dogma. And I would say it is about what works for you. But when you say, all I wanted to say was it's not just about the HbA1c. It's not just about the glucose variability. It is also about what is happening below the tip of the iceberg. The tip of the iceberg is all we can document on a CGMS and document on a this thing. If all your metabolic markers are good, you're doing great, you're doing all these other good stuff, you're doing exercise, you're doing a lot of other things, you're lifting weights, you have a low body fat percent, fine, you can absolutely do what you're doing, you're doing a fantastic job and stick to that. But if you're already metabolically unhealthy, then we need to think that our baseline might not be what somebody else's baseline is. So that is where we need to see, as I would say, especially in South India at least, a lot of people tend to have sort of bad metabolic markers. Our personal fat thresholds are much lower than, say, somebody who's in Punjab, somebody who's in North India. That's been just my observations. Back, I'm having practiced in Delhi. I used to have patients from Assam, Uttar Pradesh, Bihar, Jammu and Kashmir, Punjab, South India, and there are a lot of heterogeneity in terms of things. So I do not believe one size fits all, but it's important to take stock of what things are for you, have what you are, why you're working towards a certain goal, and use all the tools to get to that goal. For if somebody is on a roller coaster, maybe low carb may help them not be on such a big roller coaster. Maybe if somebody is already metabolically unhealthy, may help them. So if somebody is not doing any kind of exercise, which happens to a lot of people, then maybe watching the diet becomes far more important than doing nothing at all. So I think it's just about nuance. It's just about individualizing, keeping in perspective what you would want to keep, what you will do long term. I don't think there is any right or wrong. There is a lot of grays in medicine, and I think what works for you, it's really a discussion and meeting each person where they are. That's how I
yeah.
would put it.
Yeah, no, I absolutely love it. And the whole idea of having a scientific temperament, and it's not just limited to scientists or doctors, right? For us as patients, it's our job to have also an open mind and, understand. So I see that, Akshara mentioned that people do it mostly because they don't know how to dose well. Well, I did the high carb way for, over 20 years. And I think I had it down to, dosing and carb counting and all of that stuff. And really, I think the thresholds also matter, right? I mean, what you think is a good A1C versus what's the recommendation versus what really is a good A1C. I think we probably need to have a whole different session for that, so not getting into that. But last couple of minutes, I'm mindful of time. I'm going to read out the last two questions. Radhika says, what's the reason behind extra belly fat, doctor?
See, extra belly fat is really, we could have subcutaneous fat, but a lot of times what we are having is visceral fat. And it is just, unfortunately, we cannot control how fat gets distributed. Some of it is genetic, and that is why I cannot control. So that's why you cannot do targeted exercise and get rid of belly fat. It just doesn't work that way. And unfortunately, when you lose weight, the first thing that becomes lean is your face. and then 10 people ask you kya ho gaya, and then you immediately feel upset, and it's very resistant rather to get this belly fat off. So I think it's going to be a combination of watching your diet, especially going lower than wherever you are in terms of your carb numbers, and adding the exercise, maybe strength training, aerobic, some mix of that. That would probably be a longer term goal. You can do focus belly exercises and stuff, but ultimately it is going to come back from that. See, many people ask me about liposuction, okay, because they just want to take out from wherever they want. When you do liposuction, you're taking only the subcutaneous fat. It will you may take 3-4 kgs off, it will look trim and all that. It does jack shit for your metabolism. Nothing will change in your metabolic numbers. It's only subcutaneous fat which is metabolically inactive. Okay, so it's just, so you could take a tummy tuck, whatever people can do, all sorts of plastic surgeries and stuff. The hard work is going to be watching what you put in, and I would say that's where the bang for the buck is, because it's the easiest, because the amount of exercise you would need to sort of compensate for what we eat is just phenomenally hard. And as an endocrinologist, I would say I sit in my desk till the last patient is gone, and I'm sitting all day. So even though if I come back and I'm on my toes, it's just so hard. I'm still at a desk job, even though I am a doctor and I'm talking about, how important lifestyle is. So I realize that if I have to sort of manage, I have to watch what I really put in, be very conscious. It's not that, it's occasional, this, that is okay, but largely if you're doing sort of being consistent on a journey, I think that works a lot better. That's just what I
Right.
feel.
Quick call. If any of our friends have any last questions or comments, please put them into the comment box before we wrap up. And I do want to say I spent a lot of years trying to fight that thing in my head about, like, let me try every other way. Let me try. I run like 42-kilometer marathons. I'll do all kinds of things. Nothing helped, literally nothing. It was just changing the dietary patterns, and that somehow I was so resistant to it. Perhaps because we've been trained in that way, that you can eat whatever you want, and of course you can. There are memes that are made on this. You can eat everything except poison, they say. Oh, and I used to enjoy this kind of content earlier, but I think the whole point is that we all evolve, and that's the
I
whole
think
idea.
individual choice,
Yeah.
personal accountability, and as a doctor, my job is just to empower, educate, and empower. And I think the at the end of the day, when it comes to diabetes, the one thing I tell all my patients, you are in the driver's seat. I can say all this and it doesn't bother me. At some level, I care about my patients, but at the end of the day, when you suffer, you'll suffer alone. So it's something that you will have to take accountability for yourself. And I'm there as a friend on the side, sort of, nudging you along. But at the end of the day, each person has to sort of make that call themselves.
Yeah. I see you. Yoland earlier said we need Dr. Sona in Goa also. I agree, and we need Dr. Sona in Pune and in Mumbai and everywhere really. So thank you so much, Dr. Sona, for taking out the time, and it's been absolutely amazing to meet you virtually, and I hope we get a chance to meet in person as well. I see all of the thank you comments coming in, and everyone's really feeling invigorated and happy with the session. So from all of
And
us here,
Nupur, I must say you are a fantastic host, and I think since this is something which is so personal to both you and to me and to everybody here. I think how you maintain the stream of conversation. I know it's no easy task, sort of being on top of everything, but I think you did a fabulous job. Thank you for giving me this opportunity.
thank you, Dr. Sona. I think the pleasure was all mine. Chatting with you has been amazing, and I wish we could go on, but I'm very mindful of the fact that it's 1 hour. So thank you once again, and to the rest of our friends, we'll see you next Sunday, 5 p.m. for another workshop. Have a great Sunday, everyone. Thanks, Dr. Sona. Bye.
Bye.